This is Plant-Based Briefing, Autoimmune Disease, Genes, Infection, Environment, and Gut, Part 2 by Thomas Campbell, MD at nutritionstudies.org. And I'm Marian Erickson. This is the Plant-Based Podcast where I curate and narrate with permission a variety of articles on plant-based and vegan living in about 10 minutes or less every weekday. And today's article would have been longer than that, so it's a two-parter. I read part one yesterday, so go listen to that first and then come back here for the second half. And now let's get to today's plant-based briefing. Autoimmune Disease, Genes, Infection, Environment, and Gut, Part 2 by Thomas Campbell, MD at nutritionstudies.org. What about nutrition? A population's milk consumption is strikingly correlated with MS prevalence. The more cows milk, the more MS. Molecular mimicry may play a role. Recall that MS damages nerve sheaths, the important covering on our nerve cells. It turns out that there's a protein in cow's milk that looks a lot like a protein on our nerve sheaths. Our immune system reacts to both the cow's milk protein and the nerve sheaths. The link between dairy intake, autoimmune disease, and molecular mimicry doesn't stop with MS. Type 1 diabetes, a disease in which the immune system attacks the insulin-producing cells of the pancreas, has also been linked to dairy. Again, the correlation between high dairy consumption in a population and disease rates is striking. Patients with the disease have a strong immune response to proteins in milk that mimic components of the pancreas. Why does the immune system attack both the proteins in milk and the pancreas itself? Are exposures to milk proteins triggering the autoimmune process? This has been an ongoing hypothesis. It may be that the timing of exposure to milk also plays an important role. The age at which an infant starts consuming solid foods seems to affect risk. Breast milk appears to be protective. One hypothesis has been that if infants are exposed to cow's milk proteins too early, the proteins get through the wall of the gut and then play a role in initiating the autoimmune process. Animal studies support this idea. There is a type of rat that has been bred to have a high rate of type 1 diabetes. At the time of their weaning, exposure to cow's milk protein leads to a dramatically increased incidence of type 1 diabetes. Take away the milk protein and you can take away most of the diabetes. But it gets even more complicated. It turns out you can also trigger type 1 diabetes in this animal model with gluten, the protein found in wheat, barley, and rye. If researchers withhold gluten at the time of weaning, they can quite strikingly prevent diabetes. Gluten, of course, is also strongly linked to celiac disease. In fact, celiac disease does not exist without gluten. When exposed to gluten, the immune system goes a bit haywire in the intestinal wall, and the resulting inflammation ends up greatly harming the intricate surface of the intestine. The disease is cured by removing gluten from the diet. In related conditions, we also know that gluten can cause something called gluten ataxia, a debilitating disease causing loss of coordination and muscle function, and dermatitis herpetiformis, a skin rash. Both of these, based on our current understanding, are rare. Of course, it's not just cow's milk and gluten that have been implicated in autoimmune disease. We know that the risk of inflammatory bowel disorders, Crohn's colitis and ulcerative colitis, has been linked to infant feeding practices, breastfeeding being protective, cow's milk, low intake of fiber and vegetables, and increased milk and added fats in the diet. Thyroid conditions are linked to iodine intake. Both excessive and deficient intake can be problems. Gut health. Partly from the research on celiac disease, we now know that part of the problem is a breakdown of the barrier in the intestine. This involves what is commonly known as leaky gut. The seal between the cells that line the gut, which keep the outside food outside, breaks apart. Once the barrier is disrupted, incompletely digested material gets behind the first layer of cells in the gut. This can cause problems. And if autoimmune diseases sometimes cluster together, as in the case of type 1 diabetes, celiac disease, and thyroid disease, might leaky gut be playing a common role? Of course, the health of the intestine is related to the health of the bacteria that live in the intestine. But despite the rampant claims for pills and potions sold on the internet for leaky gut, inflammation, and the microbiome, our current understanding of which bacteria exactly are good, what exactly they do, and how to best support them is in the early stages of research. Generally, we know that fiber and unrefined plant foods like leafy greens help to maintain a healthy diversity of beneficial bacteria in your intestine. This is consistent with research showing that Western diets high in meat, dairy, and saturated fats, and low in fiber, fruits, and vegetables are linked to some autoimmune diseases and increased inflammation in general. So, what do you take away from all this? I wish I could offer a simple explanation that answers the question about what causes autoimmune disease, but I can't. I don't think the science supports making blanket statements about autoimmune disease, but there are some key lessons we've seen so far that may be helpful. As far as controllable factors, it seems that cow's milk is by far the food most commonly linked to autoimmune disease. I suggest to my patients that they avoid all cow's milk products. Second, avoid other components of a Western-style diet, meaning meat and added oils, and include plenty of fiber and green, yellow, and orange vegetables. Third, infant nutrition and breastfeeding may play a role, so I encourage moms to do everything they can to breastfeed. Fourth, get outside and get sun without burning, and stay active regularly. Fifth, don't smoke. Smoking has been linked to some autoimmune diseases and is unhealthy for many other reasons too. Sixth, include some sea vegetables in the diet now and then, or use iodized salt to ensure adequate iodine intake. You may have noticed I didn't mention gluten in my recommendations. I think it's reasonable to avoid gluten, particularly if you have an autoimmune disease or are at risk, but you may want to discuss with your doctor about being tested for celiac disease before embarking on a gluten-free life. Despite the attention heaped on gluten, it's not as strongly implicated as cow's milk in a broad array of autoimmune diseases. It is difficult to avoid gluten 100% of the time, and for most people, I'm not quite convinced it's necessary. I have 2 full chapters on gluten in the book The China Study Solution, which is the Campbell Plan in hardcover. By adhering to these strategies, will everyone avoid all autoimmune disease? Of course not. I believe it's clear that autoimmune disease involves more than only nutrition, but nutrition is likely the single greatest modifiable risk factor for most people. And this isn't just about prevention. There's now a smattering of evidence suggesting that diet can be an effective part of treating autoimmune disease. In various publications, diet and lifestyle treatments have shown benefits in treating rheumatoid arthritis, psoriasis, Crohn's colitis, multiple sclerosis, and even type 1 diabetes. We now know that once people are diagnosed with ulcerative colitis, consuming a more Western diet is linked to worse outcomes. Importantly, diet and lifestyle can also improve risk of related chronic diseases. Many autoimmune conditions, for example, are linked to a higher risk of heart disease. So what have you got to lose in considering nutrition as part of the autoimmune conversation? You just listened to Autoimmune Disease, Genes, Infection, Environment, and Gut, Part 2 by Thomas Campbell, MD, at nutritionstudies.org. And I'm your host, Marian Erickson. I've done some other episodes about autoimmune diseases. I'll link these in the show notes. 1081, Overcoming Lupus. 1050, What We're Getting Wrong About Inflammation. 953, 57% of U.S. adults consume pro-inflammatory diets. 923, Treat type 1 diabetes with a plant-based diet. 896, Dietary Cure for Hidradenitis Suppurativa. 882 and 883, Autoimmune Diseases and Diet, Here's What You Need to Know. 879, A Plant-Based Diet Resolved My Rheumatoid Arthritis Pain. 570, Anti-Inflammatory Diet for Lupus. 534, Asthma and Diet, Here's What You Should Know. And 373 and 374, Healing Autoimmune Disease with Supermarket Foods. And some related episodes about Crohn's and ulcerative colitis include 816, As a radiation oncologist suffering from IBD, discovering plant-based nutrition has changed my life. 771, I'm keeping Crohn's disease in check with a whole food plant-based diet. 556, The Best Diet for Ulcerative Colitis Treatment. 99, The Best Diet for Crohn's Disease Treatment. And 75, Healing Ulcerative Colitis with a Plant-Based Diet. So check those out and please share this episode with anyone who might benefit, and thanks for listening.